My name is Tziporah Rosenberg, and I'm an assistant professor of psychiatry and family medicine here at the medical center. I work side by side with patients and their providers, the rest of their healthcare team. But my job in that is not obviously medical management, but I really try to help the patients and their families manage the behavior change that's often required to maintain diabetes and keep it at bay, and also just the impact on existing relationships and families. If somebody's newly diagnosed, they're still in the stages of learning, what does this illness mean? What will it mean for my day-to-day? What new medications or diet or exercise habits do I have to develop, and what impact will that have on my diabetes? And then I also add in, depending on where somebody is with all of that, how do you navigate all those changes in the context of a family relationship, a couple relationship, or just your life? Oftentimes, diabetes is not the biggest reason why somebody's referred. We get referrals for patients who are depressed or anxious, and then we come to find out they've recently learned they have diabetes, or someone in their family has recently learned they have diabetes. Sometimes that can come from uncertainty about what the illness is going to do, both in terms of their health, their relationships. Sometimes it signals a divergence from how we see ourselves. I also have type 1 diabetes, which is really different in a lot of ways from type 2. The day-to-day management is not necessarily different, but I was just shy of 2 years old, and it will be 32 years on Tour de Cure Day, actually. That'll be my diabetes anniversary. I have been astounded by the amount of energy, support, kind of liveliness that comes about as a result of this event. But I also have learned that there's a lot to be said about having a relationship with diabetes that lasts a really long time and not being a scary story. And so promoting that and being an example of that and bringing awareness to the fact that that can happen has meant a lot more to me than I expected it would.